Zimbabwe is in urgent need of assistance following drought and prolonged economic crisis. This was announced by the Under-Secretary General for Humanitarian Affairs and Emergency Relief Coordinator Mark Lowcock following a 3-day mission visit to Zimbabwe. The country urgently requires $234 million for humanitarian assistance targeting 2.2 million people over the next 6 months.
I cry at night. I can't sleep. I cry all night. What should I do? I ask. God help me. Help me find something. I am suffering and I don't know where to begin. I don't have anything.
Erica Mandaza is one of the many Zimbabweans experiencing firsthand the devastating effects of the El Nino-induced drought. Her crop has failed and she has no one to turn to for help. A clear indication of the impact of drought in that country.
This example here is characteristic of the problem caused by the erratic rains around the whole of the country at the moment, but of course that's compounded by the economic challenges Zimbabwe faces as well. A couple of days ago we were in Epworth in the outskirts of Harare, and there's a lot of suffering there as well. So the combination of the erratic rains and the economic crisis means that at the moment there's up to 5 million people in Zimbabwe who need this kind of help, and the UN has launched an appeal working with the government for $234 million to help those people over the next 6 months.
An estimated 2.9 million people in rural areas and 1.5 million in urban areas are already severely food insecure. This food distribution center in rural Masambura, Mashonaland Central Province, is catering for 167 households. The number of those needing assistance is swelling every day, and officials are battling to meet the ever-growing demand.
The most prevalent is the elderly without support. We have got the child-headed, we have got the elderly-headed without support. We also have got the sick without support. We also have got able-bodied but who are food insecure. We also have got others who had poor harvest from the last season.
In most areas across Zimbabwe, there are acute shortages of essential medicines, and the rising food insecurity has heightened the risk of gender-based violence, particularly for women and girls. Children under the age of 5 are at a high risk of malnutrition.
We targeted all the under 5s in the households which are food insecure, because usually when a household is said to be food insecure, there is a likelihood of malnutrition in that particular household. So we targeted all the under 5s to curb malnutrition in such households.
The recipients received vegetable oil, cereal and cash. The United Nations announced an immediate release of $10 million from the Central Emergency Response Fund aimed at assisting most vulnerable people affected by increasing food insecurity.